Hello, family and friends. Today we will conclude the series on breast cancer. From our previous discussions, we learned what foods we should be eating every day to promote breast health. Now the question becomes, how can we actually get all of this health promoting food into our daily diet? It might sound overwhelming, but it's easier than you think. How about adding a daily vegetable fruit smoothie? It's the simplest way to pack in powerful nutrients. So try this combination. A handful of dark leafy greens such as spinach, kale, cabbage, or bok choy. A handful of berries such as blueberries, strawberries, or raspberries. One banana, one half of an orange or lime, a handful of pineapple chunks, ground flaxseed and pumpkin seeds, and a little bit of matcha green tea powder, turmeric powder, and ginger powder. Lastly, add your favorite unsweetened plant-based milk plus crushed ice and water. Whenever possible, use organic ingredients to reduce pesticide exposure. For dinner, how about creating a vibrant salad using dark leafy greens, cooked Brussels sprouts, tomatoes, red onions, walnuts, sunflower seeds, or pumpkin seeds? Now, let's take a look at foods to limit or avoid to lower your risk of breast cancer. Begin cutting back on butter, full-fat dairy, poultry skin, fatty meats, hydrogenated oils, margarine, fried or fast foods, sugary foods, sweetened drinks, and processed meats like bacon, ham, salami, bologna, sausage, and pepperoni. Processed meats are classified by the World Health Organization as Group 1 carcinogens, meaning there's clear evidence they can cause cancer. Next, limit your intake of refined carbs like white bread, white pasta, and white rice, which can spike your blood sugar and promote weight gain. Instead, go for whole grains such as brown rice, quinoa, or whole wheat pasta. Lastly, what about soy? In the past, some studies raised concerns about soy and breast cancer, but those studies were based on rodent research, and rodents metabolize soy differently than humans. Newer large-scale human studies show that whole food soy products like edamame, tofu, and tempeh are safe and may even be protective due to plant compounds called isoflavones. Now, if you choose soy, opt for non-GMO, minimally processed sources, and speak with your doctor about what's right for you. Check out MD Anderson's article about soy. Is soy safe for patients with breast cancer? Published on October 14th, 2024. You can also check out Stanford Healthcare Cancer Nutrition Services for delicious anti-cancer recipes. And to learn more about the importance of vitamin D for breast health, check out breastcancer.org. And remember, the goal isn't perfection, it's progress, and progress is cumulative. Every small step you take adds up to long-term protection. By consistently choosing nutrient-dense, plant-forward meals and limiting ultra-processed foods, you give your body its best chance to stay healthy, balanced, and strong. But breast health goes beyond the plate. Be mindful of your environment. Reduce exposure to harmful chemicals in cosmetics, plastics, pesticides, and cleaning products whenever possible. Choose glass, stainless steel, or BPA-free containers, and check product labels for parabens and phthalates. Stay active. Aim for at least 150 minutes of moderate exercise each week. Physical activity helps balance hormones, maintain a healthy weight, reduce inflammation, and strengthen your immune system, all of which contribute to lowering your cancer risk. Hydrate, rest, and manage stress. Your body thrives when you nourish it inside and out. Together, nutrition, movement, and environmental mindfulness form a powerful foundation for breast health and total well-being. Well, that's it for today.